A Wesleyan compound in Petit Goave, Haiti. So if you look at a map, as you go from Port-au-Prince and you go west, you come to Carrefour, then you come to Grand Goave, then you come to Petit Goave, or we call it Tigouave. It's about 150 to 170,000 people. They suffered about 20% of their buildings taken out by the earthquake. And so the hospital was damaged. The 2 ORs there are non-functioning. They estimate it maybe as long as 2 years before the hospital is fully functioning again. So we're basically running a clinic there with the blessing of the Wesleyans there in Haiti. With their permission, our nonprofit supplying residents and attendings from WashU, who are then running this clinic up through April. We're seeing about 300 people a day. And now in the past week I've been seeing 400 a day and serving as an emergency room for that population of 150 to 170.
We're in a position where we're one of the few aid relief organizations there, and in a place that direly needs it, because one of the 20% of buildings affected was their main.
If you've ever traveled in a third world country before, Haiti is a third world country. It's the poorest country in the Western Hemisphere, and they had huge problems well before the earthquake. They have had hurricanes in 2007. They've had problems even dating back to their independence in 1789. There has been a long history of problems in Haiti from a socioeconomic and political and many other aspects of their society. So if you've been to a third world country, you can imagine, but then you have to add to that a disaster that's not like things that you've seen before. Buildings that are just pulverized, sheets of concrete that look like they've been laid down like a blanket, and realize that that's affected every person you talk to. Pretty much has lost someone, lost a family member, or has a story about how they happened to go outside and when the earthquake happened. I talked to one guy, one of our translators, who left his computer and his books, but went outside he was at a university, went to stretch his legs, came back while it's coming back towards the building. The earthquake happens. And all his friends inside die. His books are gone, his computer's gone, but he walks away with his life. And so when you walk into it, it's not just a third world country, it's a third world country in disaster recovery mode with lots of emotional baggage.
And no resources which to fix that, fix the situation. I think the thing that surprised me, and I don't mean to sound crass, I got there and kind of I saw it and was like, wow, this really isn't that impressive. I mean, it's a third world country, there's not that, you see kind of every other house, you're like, wow, that's pretty bad. But then I think the thing that really opened my eyes was, as we traveled and went further and saw more damaged areas, and then all of a sudden you realize the scope of this. I think that's what was eye-opening to me. And again, I think there's quite a bit of psychological trauma that's going on. I talked with a lady the way back when we were traveling from Haiti to Santo Domingo. She's a well-to-do woman, businesswoman, spends half her year in Atlanta. And she told me she's essentially afraid to sleep in her house. She's been sleeping in her front yard ever since the earthquake because 5 people she knew were in their homes and the homes collapsed, and she doesn't trust that her home isn't going to collapse.
Yeah, I talked to a grandfather who has his kids and some of his grandkids, 18 people total living in his house, and he talked about trying to get 18 people out of his house in the 7 seconds that the earthquake happened. And he almost breaks down and said everybody made it out. And then the next picture you see is a grandmother and her 3-year-old grandson, and they're the only 2 members of their family left. The emotional problems, the social problems will last decades in Haiti. Certainly 2 and 3 weeks, even 4 weeks out, we were seeing injuries that had never come to medical attention, open fractures, wounds that had never been dealt with. So one particular guy who came to mind came the 3.5 weeks after the earthquake, a beggar who lived on the streets who had basically an open fracture here, had bones sticking out, the distal part of his finger barely hanging on, but still some blood flow. An open fracture here as well is going to need an amputation at least back through his metacarpals, but had maggots rolling around in it, growing out of his wound. And because he's a beggar and because he has no resources and no family, that's what he was destined to do. And so we brought him, gave him antibiotics, debrided his wound, cleaned it out. But I'm not an orthopedist. I can't amputate his fingers. And so we gave him regular dressing changes and then have made connections down there for him to be set up with an orthopedist. I think they referred him to Leogon, which is where we've been sending some patients. The University of Iowa there has a big group working with the Canadians and the Cubans to have him have an orthopedic repair so that he doesn't die of this open fracture infection.
And beyond that, I think a far majority of what I had encountered was people who had been seen, treated appropriately initially, wounds dressed, and they didn't know to change them. And so 2 weeks later, when we're seeing them, their wounds are drastically infected. They need to breed it, and so while there was this huge outpouring of support immediately after the earthquake, and people got down there and really helped out, I think there's this lack of continuation of care that's going to happen, and that's what we saw, I think, firsthand.
Yeah, and it's going to be a huge problem because where do you send the girl that has the X-fix on? Where do you send the kids who have had a humeral fracture that was splinted and is now growing like this? Where do you send the 10-year-old boy who has a whole leg cast on for his femur fracture? I can take his cast off, but where does he get follow-up care?